Oh crap.
It's on.
Is it working?
It's good. It's working.
Hello, Chelsea.
Hello.
My name is Natasha. I'll be taking care of you today.
Hi, Natasha.
I have a couple questions. I'm going to first check your respiratory system.
Okay.
I just have a couple questions about first a health history, risk factors, and then I'll go with the physical assessment. Okay?
Okay.
Alrighty. Do you have any trouble breathing at all?
No.
No. Any coughing up anything?
No.
No. All right. How about any difficulty breathing at night? Especially, do you sleep in a chair? Are you able to lay flat in bed?
Yeah, I'm able to lay flat.
Okay,
I only
and-
use like one pillow.
Okay, good. And you don't feel short of breath at all?
Mm-mm.
Any with exercise?
No.
No. Okay. And I'm just going to ask you some risk factors that could be associated with any kind of lung diseases, lung problems. Do you smoke cigarettes at all?
No.
Alrighty. And how about any history of asthma, any lung disease?
I just had
COPD?
sports-induced asthma when I was younger.
So did you grow out of that?
Yeah, basically. I mean, when I exercise now, I don't have an inhaler.
And
or
you don't.
anything.
Okay, so you don't use an inhaler
No.
or anything. So that was just
Nope.
when you were younger.
Yeah.
Okay. So first, I'll just have you sit here. I don't notice any abnormal postures. You feel okay taking a nice deep breath?
Yes.
No glue of the fingers around the mouth at all?
Nope.
Alrighty. You seem like you are nice and pink. Your skin's warm. You're not having difficulty breathing, leaning over when you take a deep breath at all.
No.
Alright, and then I'm just going to check first the posterior side of your chest. And then I'll do the anterior, okay? The first chest, my hands are just going to be put on you. I just want to make sure when you take a nice deep breath, everything is normal and symmetrical. Nice deep breath, which it is. Alrighty. And then I'm just going to check you here. I want you just to say a couple words for me, okay? This is just to make sure you have some normal, palpable vibrations, alrighty?
Okay.
Now these sounds are transmitted from the larynx to the bronchi, which produces some vibrations which are normal, alrighty?
Okay.
First, I'll have you repeat the word 99 for me. I'm just going to check. Say 99.
99.
Okay, say it again.
99.
And 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 one more time.
99.
Alrighty, and I did feel vibrations. That is normal. And then how about blue moon? I'm just going to repeat blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Okay,
moon.
perfect. Everything seemed normal there. Your chest expanded symmetrically. I did hear the vibrations when I palpated. Alrighty, and the next thing I'm going to be checking here is I'm going to percuss, making sure that everything sounds normal, feels normal. No tenderness at all when you feel me palpating.
No.
Okay. Let's see, the next thing I'm going to do here is, alright, I want you to take a nice deep breath as I palpate and hold it. Alrighty. Okay, everything, I don't see anything abnormal. Now I'm just going to listen to your breath sounds off field already. Take a nice deep breath. And again. And again. And again. And again. And again. And one more time. Alrighty. They all sound normal and clear. I don't hear any kind of adventitious breath sounds, anything abnormal. Now I'm going to just palpate the front of your chest, if you could just turn around. Alrighty.
You're good.
Take a nice deep breath. There we go. Nice deep breath. Okay, everything was nice and symmetrical there also, which is normal. And I'm just going to palpate now again, alrighty? And I'm going to have you repeat those words 99, okay?
Okay. 99. 99. 99. 99. 99. 99.
Oh, and I heard the normal vibrations again, which are normal. Nothing seems abnormal when I palpate, okay?
Mhm.
And then the next thing I'm going to do here is just again listen to your breath sounds in the front, making sure that I don't hear any abnormal sounds. Everything sounds equal and clear. Nice deep breath. And again. And again. And again. And again. Again. One more time. And then one more time here. Okay. And everything is symmetrical and clear. I don't hear any kind of abnormal breath sounds there again. So it all seems good with your respiratory system. Your lungs seem nice and clear. I don't see anything abnormal. Your chest is shaped normally. You're not slouching over, having any difficulty breathing, having any difficulty speaking to me. You know, you're nice and pink and warm. So everything checks out okay with that. The next thing I'm going to do is check your abdomen, which is the next assessment that we're going to check, okay?
Okay.
Maybe we should pause. Okay, first I'm going to ask you a health history. Any allergies to foods at all?
No.
Any change in your appetite or diet?
No.
Seems normal. You didn't have any kind of rapid weight loss, weight gain.
I wish, but no.
Nothing bothers you when you eat. You don't have any kind of ulcer, reflux?
No.
Okay. How about any difficulty chewing or swallowing?
No.
No. And another thing that could upset your stomach is if you take any kind of NSAIDs, any aspirin, ibuprofen, nothing like that that you take, you know, on a regular basis. Okay. And then some risk factors also that I'm going to ask you again is, do you use any form of tobacco, any smoking, chewing, pipe at all, anything like that?
No.
Which are going to irritate the abdomen. And how about caffeine? I know we all have caffeine, but how much do you use daily?
Probably like I have like 2 cups of coffee
Okay,
daily.
so nothing extreme.
No.
Okay, just a mild amount.
Yes.
Alrighty. So first I'm going to have you lie down for me on the bed. Very good. Okay, and then I'm just gonna check your abdomen, making sure that everything you have the space there, everything looks all right there. Perfect. I don't see that your abdomen, it's not distended, it's not rounded, it's nice and soft, non-tender when I touch, correct?
Correct.
Alrighty. I'm just going to check your belly button. It's in the middle.
Yay.
In line with everything else. Perfect. Okay. It's not inverted at all. I don't notice any kind of hernias or bulging or anything like that. Okay. The skin around your stomach is nice and smooth and soft. No lumps or bumps there. No lesions that I know. No abnormal skin pigments. I don't see any kind of moles or anything like that also.
Okay.
So the first thing we did, like I just did, is the inspection of the abdomen, which is what you want to start with first. Everything looks normal, okay. There. Then I'm going to try and listen to your bowel sounds, okay?
Okay.
You want to listen before you palpate, because they could change the sounds. So I'm going to first begin with your right lower quadrant.
Okay.
Okay, you have 4 quadrants in the abdomen. Right lower, right upper, left lower, left upper, and making sure that you have bowel sounds there. I'm just going to listen. Okay, and they're all equal. I don't hear any hypoactive bowel sounds. They're high pitched. Everything sounds good with them. I don't hear. I'm just going to check over the aorta, renal arteries, iliac, femoral arteries to see if I hear any brotes or anything like that, okay?
Okay.
First, I'm going to start with the aorta. And then the left renal artery, the iliac artery, and the femoral artery. And it all sounds normal also. And there's no sound, which is normal when I go over there. You don't want to hear anything.
Okay, good.
Alrighty. And then the next thing I'm going to do is percuss around the liver, spleen, all 4 quadrants, okay?
Okay.
Alrighty, that all sounds normal there also. I don't hear, did you urinate right before you came like I asked you?
Yes.
Okay, so your bladder is empty.
Parish 5400. D Parish 5400.
No distension at all.
No.
Alrighty. Alright, just give me a moment just so I get my next things together here, okay?
Okay.
I just want to see what I'm supposed to be. I keep saying normal. Alright, let me just go over my readings here. Alright, the next thing I'm just going to do is measure the distance over the liver span, okay? Adult usually ranges from 6 to 12. Alrighty, and yours is measured 7 centimeters, which is within the range of the 6 to 12.
Right.
And then the final test I'm going to do is a scratch test. This helps define the liver border when the abdomen is distended or the abdominal muscles are tense. Okay, so I'm just going to place my stethoscope over your liver and with one fingernail scratch the abdomen starting in the right lower quadrant again and moving to all other 3 quadrants, okay?
Okay.
Alrighty. And that all was within normal range also, okay?
Okay, good.
Okay, and then the next thing I'm going to do here is check your spleen. And I'm going to want to know a dull sound, okay, from the 9th to the 11th intercostal spaces. Alrighty. And I'm just going to have you take a nice deep breath when I'm doing this. Okay, now if you could just sit up and I'm going to just check the back, okay?
Okay.
And see if you have any tenderness or pain around the kidneys. Any tenderness or pain at all as I touch in there?
No.
Okay. Alrighty. Alright, everything is checking out okay with your abdomen again. Alrighty. Now, the last thing I'm going to do is palpate.
Okay.
If you could just lie back on your back. Okay, and then I'm just going to have you bend your knees up.
Both knees?
Yes.
Okay.
No, like,
Oh, like this.
there you go.
Okay.
Correct. And this is just going to check your organ size, location, seeing if there's any tenderness or abnormal masses, okay?
Okay.
And I'm just going to have you breathe nice and slowly as I do this, alrighty? So I'm going to first start with light palpation, and then I'm going to move into deep palpation, okay? Some discomfort is normal when I do deep palpation. Just let me know if it's anything that you can't handle, all right?
Okay.
And I'm going to start down here.
Okay.
Okay, I don't notice any abnormal masses or organs don't seem to be enlarged at all. Any tenderness that's severe?
No.
No. Perfect, perfect. Okay. Alrighty, and I'm going to check the spleen, liver. Just going to check now any kind of rebound tenderness at all. Alrighty. Any tenderness when I let go. Not when I push in, but when I let go. No? Okay. Perfect, perfect. Everything's checking okay with your abdominal assessment also.
Good.
So you would do a obturator test. I believe that's how you pronounce it. Only if appendicitis is suspected, but you're not having any pain in the right lower quadrant. You don't have any tenderness when I palpate. You don't have any rebound tenderness, which is also a sign for appendicitis. So we're not going to go and do that because everything checks out okay with that. And as far as everything else looks okay. You're having no pain, tenderness. Stomach is soft, not tender, not distended. You have good bowel sounds in all 4 quadrants. You could sit back up.
Okay.
Any questions?
Nope.
Nope. Okay.
Nope.
You don't have any risk factors, so everything looks okay with that.
Okay, thank you.
Thank you.
I think you push the display button. I don't know.
Stop.
This is probably still being recorded.